Department of Health inspects government hospitals to evaluate their capacity to withstand disasters. The agency said it would revoke the licenses of medical facilities that could not comply with the requirements. Kimberly Go filed this report.
The Department of Health says most government hospitals are disaster resilient. This means that after disaster strikes, these hospitals will be able to operate. It will have ample resources such as water, power, and medical supplies to continue functioning.
Our public hospitals have been implementing this ever since the 90s and even before that, and we've become very good at it.
What varies, however, is the level of preparedness of hospitals. DOH continues to assess and reassess hospitals in terms of being prepared for disasters.
The Department of Health, before we license, will look at your disaster plans. And then PhilHealth will not reimburse you if you do not have emergency preparedness plans to protect patients already that are confined in the hospital.
Hospitals have to follow a building code which mandates hospital buildings to be able to withstand earthquakes. There is also the fire code, which is continuously assessed by the Bureau of Fire. Hospitals which don't meet the standard are asked to improve within a deadline. The DOH will revoke the licenses of hospitals who cannot comply. Her boss says they are continuously trying to elevate the standards of the country's hospitals. One such way is by providing incentives such as the Kalasag Awards, which is given yearly by the National Risk Reduction Management Council. The Quirino Memorial Medical Center won the Kalasag Awards for 2 consecutive years. Their secret, a close collaboration with the community in disaster response. One such example is their close collaboration with the barangays in their area.
A separate unit of our institution na nag-handle po ng barangayan. So, sila po yon na nakikipag-communicate with the barangayan monthly. So, may monthly meeting po kami with our barangayan. So, updates, seminars, kung may problem po ang institution na kailangan i-address ng barangay, so nakakatulong po yung barangay talaga sa amin. Or kung may problem ang barangay in terms of health, in terms of their community, na ipapaabot nila sa amin.
Mercado says they are working on a program which will train barangay officials on first aid and usage of ambulances.
Magre-respond muna ang barangay. So sila muna yung magre-respond. So sa bahay pa lang, nagkakaroon na siya ng initial intervention. Pag dinala nila sa ospital, stabilize na yung pasyente. The more na nasa-save natin yung life ng patient.
This will equip local government officials to assist QMMC during times of calamities. Mercado adds in terms of hospital preparedness, they make sure to regularly conduct orientation seminars for old and new employees on disaster preparedness. This in collaboration with the Bureau of Fire and PHIVOX. But more than institutional preparedness, her boss says what makes the Philippines above among other countries in terms of hospital disaster resiliency is its disaster culture. He explains the country makes up what it lacks in resources through good methodology and planning.
We are one of the top countries with disasters in the world, even in the effect. That's from the Center for Disaster Epidemiology. And we're still here as a country. We're still more powerful. If we were some other kind, we'd be weakened and we'd be weak and poor in our knees and everything.
Educating the youth on the concept of disaster risk management will also be of help. Kimberly Go, Solar News.